about you?
Yeah, fine, sir, fine.
Yeah.
I think lockdown, I can able to
Yes.
see from your face. Yes, I will take, I think, room is full. We will start the session, sir.
Yeah.
Yeah, good evening, sir. Good evening to all. Today, we are going to have another session on ethical components of mental health practice. On behalf of the Department of Psychology, the American College Madurai, on behalf of the participant over here and my co-facilitators over here, I welcome my friend, my teacher, my mentor, peer mentor, Mr. Vigraanth Bapu. He is a renowned clinical psychologist in Bangalore. I think when I was joined co-faculty at Rajiv Gandhi National Institute, we had a lot of interactions regarding the subject. And he made me to learn different subjects in different angles. Thank you for that. Now with us, he is going to share his experience on ethical components in mental health practices. Sir, I welcome you. Please take over the session and enlighten with your knowledge and experience, sir. Yes.
I'll do my best. Thank you so much, sir. Thank you for the kind introduction. Just a second. Let me share my screen. Yeah. I hope all of you are able to see. Yeah. Yeah. Good evening, everyone. So it's nice to meet you all through this webinar organized by Dr. Suresh from Madurai American College. So thank you so much, sir, for calling me, for making me talk about this topic. It's a topic of, let's say, a lot of controversies, a lot of interest personally for me. So first of all, let me start the session by asking all the participants a couple of questions. So first is, how many of you are aware what is ethics?
Sir, may I say it?
Yeah.
Ethics is nothing but certain principles to follow in our day-to-day life, and even in our profession also, we need to follow some ethics. For every kind of job, we need an ethics.
Okay. Okay. That's brief enough introduction about what meant by ethics. Yes, but ethics is more than that. Ethics has a lot of components apart from what was discussed right now. So by the end of this presentation, maybe I'll try to enlighten you about
Sir,
the
not
different.
audible, sir.
Sir, yes, sir.
Am I audible now?
Yes, sir.
Yeah.
Yeah.
Okay. So yes, I was telling that ethics is much more. It's a larger bracket of umbrella that we are having. So ethics is something that it's a must to follow in, especially in our field where we are dealing with a lot of humans. So we'll be, by the end of the session, I was telling that you'll be more aware about the different ethics that we have, what are the things that we have to follow, and where. And since our time limit is just 40 minutes, I'm trying to limit on certain most important things that would be essential for us. Yeah. So next question is, how many know the different ethics in psychology?
There are some 13 ethics given by APA which we have to follow.
Okay, fine. Okay, so some 13 is given by ethics that we have, by APA that we have to follow. Anyone else? Are you aware of?
According to me, psychology is different from ethics, sir, because it depends. The ethics can be varied from individuality.
Okay.
Depends upon person. That psychology doesn't correlate with ethics, that I think.
Okay. Okay, so you are telling that
person to person ethics can be varied.
Yeah, person to person ethics can vary. That's a very interesting point that we have brought out, sir. Thank you so much. May I know your name, because I'm
Yuvaraj, G. Yuvaraj.
Yuvaraj, yes, yes. So you have brought out a very brilliant point. We need to actually look more into those perspectives actually. So we'll, as we go into the discussion part, we'll try to get a more idea about what it is. And one more question I have: how many of you had, I'm sure that most of you sitting here have some basic training in psychology. So for how many of you was this ethics a part of your current syllabus or training?
It was the part of my syllabus in my MSc first year, first semester. So in our very first semester, we learned about psychological ethics.
Okay, that's nice. Okay, anyone else?
So in my
was also
training,
part of my
sir, I am familiar with ethics, the notion of ethics.
Okay, you're okay. It would be nice if you can introduce yourself so that I later, if you, I can come back telling your name. That's why.
I am Dr.
Sorry,
Chinnapan.
again, this is Yuvraj.
Yes, yes, sir.
Sir, for BE, not only for BA, for all bachelor degree at the end of the final semester or mid semester, they may have a subject like professional ethics. So for any degree, that students have to undergo about this ethics to work.
Okay.
So for Anna University, actually I'm in Tamil Nadu.
Okay.
It has been followed for 7th semester in BA. In particular, I would like to say, I'm working in SRM University. They have the ethics maybe in 3 different volumes, which can be split over 4 semesters.
Yeah, very true, very true. So it's a very vast syllabus actually to cover within a single degree, which we can take ahead and we can keep doing, we can keep talking about it for a long time. So there are so many things when we talk about ethics and ethical violations. So thank you for answering these questions. So let me get into the topic a little bit. So I'm trying to answer these questions. I know some of you might be familiar with these aspects, some of you might not be. So I just want to introduce to these two topics. Basically, I'll be answering these two questions. What is meant by ethics? What are a few ethics that we have here in India? And why do we need ethics? These are two basic questions which I would like to answer through this webinar. So this is one of the very brilliant statement that recently I had read somewhere. So it says, when ethical lapses occur, they rarely happen in situations when what is right versus what is wrong is clear. That is what we have to understand. When something is very clear that this is right, this is wrong, this is where you belong, this side of it is bad, this side of it is good, then there is no ethical lapse which is happening there. But these kind of ethical lapses more typically occur when what is more morally right is less clear. We need to very clearly understand this point, because this is where ethics becomes very, very important. So when we don't know, when we are not very clearly understanding what is morally right, that is where this moral or ethical lapses start happening. So I started browsing internet by trying to understand what is ethics. So yes, we'll go by a very dictionary based definition. According to Oxford English Dictionary, it defines ethics as the moral principles that governs a person's behavior or how an activity is conducted. Very simple. It talks about ethics on all level. So it is talking about ethics from any different areas. So according to Oxford English Dictionary, it's a moral principle that governs a person's behavior on how an activity is conducted. That's all. But when it comes to psychology, in the context of psychology, it means much more. It implies understanding the moral principles that are underlying that particular psychological thought and the activity that we are having right now. Ethics basically became very, very important in the field of psychology through various researchers actually. So we would have heard about Stanley Milgram's experiment. We would have heard about many other experiments where ethical violations had happened, where people were not informed why they were. There were a lot of mental distress because of the research which had happened. So that is where slowly they started feeling that there should be something which governs all the psychologists at a platform. So let it come be therapy, let it be assessments, let it be research. In all areas, there must be basic understanding of what it is for all the people. So that is where they started venturing into the field of ethics. So APA also started venturing into ethics after these kind of researches started happening. So as I've mentioned, ethics broods over a large area from research in psychology to practice in psychology. It covers a vast amount of area. And here today we are going to mostly focus on the last aspect, the mental health practices aspect is what we are going to focus, not on the research. So according to APA, what is ethics? Yes, APA is the one which we are following, which we have adhered to right now. So yes, yeah, according to APA, it can, the ethical principles of psychologists and the code of conduct could be divided into its introduction, preamble, the 5 general principles, and the specific ethical standards. These 4 are the basic parts of ethical principles of psychologists and the code of conduct. When we talk about the general principles, they themselves are not enforceable rules. They are just, they should be considered by the psychologist for us to arrive at an ethical course of action, what we have to do, how we have to go there. Just principle helps in understanding those things. So it is nothing but, it's more like it gives us a pathway to reach proper ethical decisions. So the ethical standard is what we are more concerned into, because these are the ones which are more enforced by law. It is more legally applicable. So the ethical standards set forth enforceable rules for the conduct of a psychologist. Here we are talking about psychologist on the whole. We are not focusing on any particular field, and even APA tries to define ethics for all the field equally. They are calling APA's code of conduct for psychologists. They are not classifying on any particular uh, specialization. So coming to ethical standards, where we'll be more focusing, most of the ethical standards are written broadly. Okay, so that, because as I told, here APA tries to define it based on um, for psychologists. So they have written it in a more broader aspect in order to apply for all those specialization fields that can come inside. So, and ethical standards are not exhaustive. Whatever is given, actually, in accordance to APA's recent ethics, there are 10 ethical standards that we have, and 5 ethical principles we have. So these 10 ethical standards are not done by itself. It can be extended to any further areas. So the fact that a given conduct is not specifically addressed by an ethical standard does not mean it is not either ethical or unethical. So we need to very clearly understand this fact, because APA in its introduction very clearly mentions, if it is not mentioned, it doesn't mean it can be either ethical or unethical. So we need to clearly come to an understanding by making sure we understand the ethics clearly. So the ethics code is intended to provide guidance for psychologists and standards for the professional conduct. So this is a basics of what we are going to look into. Let's get into the code of ethics according to APA. So if you ask me, APA is not the only one. There are many other organizations in itself which has come up with different code of ethics. But our focus here today is mostly on APA, because when you look into the Indian context, many of the organizations which has adopted the code of ethics, it is basically from APA's code of ethics. So I want to focus more into these aspects than others. So code of ethics, again, ethical principles could be beneficence and non-maleficence. That is, looking into the well-being of the patient and making sure we are not creating any harm for the client that we are facing. Okay, so whenever we have to make sure that we are working towards their well-being and we are not creating any harm. And next is fidelity and responsibility. Yes, it is more of a human relationship that we are going to enter into when we are talking about any kind of therapy or sessions, counseling sessions that we are having. So we have to maintain the professional boundaries. So it talks about fidelity and responsibility. Next is integrity. As a psychologist, what are my roles? How integrated am I with those ethical policies, ethical principles, and with the role that I am having? Making sure I'm creating proper justice for these clients under me. And also the most important thing, which has been repeated by other organizations very clearly, is making sure we have a respect for the people's right and their dignity. That becomes the most important thing. So these are the ethical principles. So by law, they are not enforceable, but as a psychologist, we have to make sure that we are following all these ethical principles. The next is ethical standards. In ethical standards, these 10 are there, but we are not going to discuss about all these 10. We are going to discuss about very few here. So one is resolving ethical issues, competence, human relation, privacy and confidentiality, advertising and other public statements, record keep and fees, education and training, research and publication, assessment and therapy. These are the various areas when we are talking about ethical standards. These 10 areas are the most important things that we need to understand. And today, based on my experience or my short venture into this field of ethics, what kind of mistakes I've seen happening around in India, that is what I'm trying to discuss here. So yes, first and the most important thing is competence. So can anyone tell what is meant by competence?
Yes, the
Yeah.
ability that you are perfect in your work, that is competence.
Okay.
Either if
Good.
psychologists are not competitive, they don't have competence, still they take client and they miserably just, just ruin their life.
Yes. Very, very beautifully put. Yes. So competence is what are the skills that I am possessing as a psychologist. Which area am I trained in? Okay. We have to very clearly understand that training process must be a elaborate process where I am trained in, where my skills lie, and based on that, me taking a client. For example, even though I am a registered clinical psychologist, I have very particular interest in child and adolescent related cases. So most of the time, I tend to take those cases. But when I venture into a geriatric or an adult-based population, my competence is a little bit lesser than the other areas. So I would prefer not working in those areas, and I would look working into more into a child and an adolescent case, because that is where my competence has been in the last few years. I have developed my competence in that area in the last few years. So I would like to work. In case I need to change my area, then I need to make sure that I am gaining competence in the other areas and then making sure that I am venturing into those areas. For example, if I want to venture into geriatric population, I need to understand what are the most common problems happening in geriatric population, and what, as a psychologist, what are the skills that I need to gain, because handling a child case and a geriatric case might be completely different. The amount of experience they have, the amount of problems they have faced, the problem solving skills, their attitudes, everything will be different. So I need to understand what kind of skills I need to gain in order to handle them. So first and foremost, ethical labs that I have seen happening across India is in terms of competence. So there are many people who don't possess enough competence to handle a particular uh, client. They will take up those cases, and in the end, as it was told before, they might end up ruining the patient's or the client's whole life. Because when we are trained, so we might have the skills, we all might learn, we might have maybe in our masters we might have learned how to administer cases, we might have learned how to administer a rosha, we might have learned how to do certain things, we might have learned what is MSc, the different things in MSc, we might have studied pathology. But in Indian scenario, that doesn't make you a skilled, it just makes you a skilled person. You're not a licensed person still, because in according to the law, according to Mental Health Act 2017, very clearly states that here in India, to practice as a clinical psychologist, to use the term clinical psychologist, you need to have completed a particular prescribed course, which is governed by Rehabilitation Council of India. So it is very clearly stated there. So we have to make sure that we are completing that course in order to practice as a clinical psychologist in India. So as you would have seen, many people, they complete or they use a board called a counseling, but they venture into the areas of other clinical areas. It is not like they are not skilled enough. They might be skilled enough, but according to the law, they don't have the license to practice in India. That is where we have to be very careful. So in competence, they discuss about various aspects of competence. One of the most important things is the boundaries. That is what we have been discussing till now. So as a counselor, again, my area of interest might be more into career counseling than adolescent counseling or any other areas of counseling, not maybe not problem solving or any other areas. My focus was only on career counseling. So my boundary, I should understand, and I should make sure I'm working around that boundary. I should not overshoot my boundary of competence. And APA, even though APA says that you should maintain your boundaries, in certain cases, very, very, very limited cases, it says that you can provide basic services in emergencies, only in the emergency period. And once the emergency period has been resolved, it is your duty to make sure that the person goes to the respective person who can handle them. So maybe they would have come for, let's say, some kind of marital issues. So we might have referred them to a family therapist. But since the family therapist is not available right now, or maybe because of the COVID-19 situation, they are not able to approach the family therapist, what we can do is we can handle the patient on a basic level, and we have to make sure that they are able to maintain it. And once the situation comes down, then we have to make sure that they are going back to the services. APA very clearly maintains that. And third is maintaining competence. That is making sure we are updating our knowledge every time there is a course happening. There is a particular, so every time I venture into a particular area, I try to learn more about it, know what is new in it, and we have to make sure we are maintaining the competence to practice in that area according to the changing generation. We have to understand the basis for scientific and professional judgments. We need to understand what is the delegation of work to others, when we have to refer back, when we have to understand what is the work of others. All these aspects we need to understand. That also becomes a part of your competence. Then we need to also very clearly make sure we have to resolve all our personal problems and conflicts before we start into our professional practice, because sometimes our personal problems and conflicts could hamper into the progress of the client, and that can in fact have a major impact on the patient. The next and most important thing, which again in Indian scenario is missing, is human relations. So human relations, yes, the whole psychological process itself is based on human relations. So when someone is coming to meet me, it is an new interpersonal relationship that we are forming. But here we should make sure that we are not having any unfair discrimination, maybe based on their age, maybe based on their religion, their caste, creed. We should not have any unfair discrimination. We should make sure we should avoid doing any harm. Even though we are not doing any good to them, we should make sure we are not doing any harm to the individual. We should make sure that they are sent to someone else. We should make sure that we are not involving into any kind of multiple relationship with the client apart from in a therapeutic setting. Getting into a relationship outside the therapeutic setting is not at all allowed. There should not be any conflict of interest. It's very important. And the third party requests for other service, it becomes your responsibility to make sure that they are going there. And we should not exploit it. We should not get into an exploitative relationship with them. And we should be cooperating with other professionals. For example, I might have got a child case where I might need a neurological review. So I might refer them back to a neurologist. So I should be able to cooperate with other professionals to maintain the well-being of the individual. And most important, we need to collect informed consent. In the informed consent, we have to make sure that we are mentioning what is our role, what is their role, where the boundaries get over, what is confidentiality.
Yes. Mr. Vigraanth, your voice is very clear, but it is very low, not audible. Yeah. It's very clear.
Okay.
It's very clear.
Yeah, but, thank you, sir. I understand. I think I have to hold my mic. Are you able to hear me now?
Yeah.
Yeah. Okay, I'll hold my mic in my hand. Thank you so much.
people were thinking that they are not able to hear.
Oh,
Yeah.
okay. I was not able to see that. I was not able
Thanks.
to
Thanks.
see. Yeah,
Yeah,
yeah. Thank you so much, sir. Yeah. So coming back, informed consent is next most important thing, because as a psychologist, anytime when you are involving into a relationship with another human being, a therapeutical relationship, it is very important that you have collected the informed consent, that you will be doing these things. As a psychologist, this is your role. As a client, these are your roles. So we need to make sure that we are uh, mentioning each and every aspect of confidentiality of all those aspects when it comes to human relationships. And also psychological services delivered through to or through any organizations, we have to be very clear what is our role there. Not our role is not to help or be part of that organization, but to help the individual. We should be very clear about that. And also, whenever there is an interruption of psychological services, what has to be done, how we have to terminate these sessions becomes very, very important. uh, Coming back to the next and most important thing, we all know whenever we talk about ethics, this is the only point I keep hearing from my students. So when I ask ethics, what is ethics? So confidentiality. Apart from confidentiality, can you tell anything? Nothing comes out. So confidentiality becomes very important. Even when I was talking about informed consent, I was telling about the limits of confidentiality and other things that must be mentioned in the informed consent form. That is what we are going to look into here. So when we are talking about privacy and confidentiality, we have to make sure that we are maintaining confidentiality. So when we are saying confidentiality, it also means that we are not supposed to take the person's name, the client's name, and discuss that particular client's details in front of others. Okay, so you are not supposed to reveal any of their information for any particular reason. So we have to make sure that we have to maintain utmost confidentiality in our practices at any time. They could have come for anything. They could have come even for a very small problem. They would have come for the smallest of small reasons. Still, we have to make sure that we are maintaining confidentiality. And also, whenever we are discussing about confidentiality in certain cases, especially when we are talking about cases like suicidal ideation, or when we are talking about cases where there can be chances of legal aspects being involved, we have to discuss the limits of confidentiality. We have to make sure that we are telling them where this confidentiality can get over. So when I can take it out to legal aspects, everything must be discussed before we start the therapy session. And then next is recording. In certain places, recording is allowed. For example, they can be recording the whole session for further uses, but these recordings are uh, first we need to take the permission of the client, that for this purpose that I am taking the recording, we need to take the permission from the client before we start recording the session. Then we have to minimize intrusion on privacy. So whenever they say it is something that I don't want to disclose, it becomes very important for us making sure that we are not doing that. Disclosure, everything we are going to tell, what details we are going to tell, everything.
Um, uh, Vigraanth, we have about 6 minutes before
Yeah,
this session gets over,
yeah.
and we will log on to the same thing, same link. So accordingly, we can plan.
Yeah. So according to me, it's showing 9 minutes. So I'll continue maybe until we go to the last end of it. I'll let you know. So when we are closing to 2 minutes, I'll let you know. Maybe we can shift. And yeah, coming back, we have to make sure we are disclosing consultation with other colleagues of ours. We have to make sure that we are discussing it before we go out. We have to tell to the clients that I need to consult with some of my other people for helping you. We need to make sure we are mentioning everything. And also, use of confidential informations for certain didactic or other purposes such as research and other things must be taken consent from them before we get involved into it. These things are very, very important to maintain. Next, and when we are talking about privacy and confidentiality, I have seen certain, we have a small group where we start, we share certain things, how things are happening. So about ethics and other things. So I have seen in certain WhatsApp group that people are discussing about their clients with their names, their details, that they had seen such case, this is what they have gone through, this is the kind of treatment that I have given, this is what I did. Maybe even to just boast about themselves, they share all the details of the client, and they go to the extent that they share the name, the age, the where they come from, what kind of problems they had, everything is being discussed. This is one of the major ethical violation that we are seeing around in India. So I have got such kind of instances a lot of time. We have seen my friends listening in other groups, or in, they got through some of their friends that they have been, there have been such kind of activities that has been going around. So we have to make sure that such kind of ethical lapses must not ever happen, because maintaining confidentiality is first and foremost thing that we have to do in the psychologist context. Next is advertising and other public statements. Even I have seen so many advertisements. I don't know how many of you have heard, but some people claim that they have cure for mental retardation and autism through some of their practices. They can either through correcting their handwriting, or by doing certain kind of practices, that they can cure mental retardation and autism, or any such kind of neurodevelopmental disorders. For they say that they can cure it. So these kind of false and deceptive statements must not be ever used in a advertisement. We can advertise about ourselves, but whenever we are advertising, we have to make sure we are not using any false or deceptive statements that I'm going to cure your child, I'm going to do these things. And also we should avoid any such statements made by others as well. Sometimes a parent might not know that instead of saying my son was rehabilitated, or my son was able to do certain other activities than before, they might say my son is cured. So even these kind of statements by others must not be encouraged. And we should be very clear about the descriptions of the workshop that we are doing, and the non-degree granting educational programs. So we have to very clearly, even now, just before the session was started, we had been discussing in our group about a particular advertisement that was shared, where they say that they are going to give an introduction to it's a webinar series, which is a around 2 hours webinar series, where they are charging an enormous amount, and they claim that you can practice as a counselor after completing the 2 hour webinar series. So these kind of non-degree granting educational programs, we have to be very, very clear, and in their description they should mention that they are not, or they cannot practice, or it is a non-degree granting educational program that is happening. Because I'm a member of an APA as well, so I attend a lot of programs that is organized by APA. So everywhere very clearly a statement will be given in their certificates. When we complete the program and we go through all the assessments, we get a certificate very clearly saying that this is a non-degree granting educational program. So we should start practicing that in India. And also when we are coming to media presentations, we see a lot of psychologists being represented in the television these days. Many of them come up with false claims as well. So those kind of false claims must be avoided. And in testimonials, we have to make sure when we are publishing a testimonial given by someone, we have to make sure we are maintaining the confidentiality. And also we have to make sure about in-person solicitation, where the person himself comes, talks about you, tells about what you have done. All these things must be very carefully recorded, and when we are publishing, we have to be very, very careful. So when we are advertising from these perspectives, we need to be very careful. Coming to
Sir, your voice is too low, sir.
again, I'm keeping the mic as close as possible to my mouth.
Okay, now it's audible, sir.
Okay, fine. So I'm trying to keep it close to my mouth. Yeah. So coming to the next most important thing is assessments. So we have seen so many assessments, or so many
Should we
claims of.
even rejoin again?
Yeah, last 3 minutes is remaining. I think that would be better because we can have a continuous discussion by the end of it. We can leave this meeting and we can join again. Yeah, thank you.